Okay. So I heard that you just took quite a tumble. Yeah, you were downhill skiing. That can be so dangerous. I feel like people don't really realize it because it's such a popular sport. But thank God that you were wearing a helmet, and I'm very glad that they were able to bring you straight to me. So we can do just a quick exam and check you out just overall, and then assess you for any head injuries. Like I said, thankfully you were wearing a helmet, so that's good. Don't expect to see anything too major, but we do like to just be very thorough, as sometimes these things can kind of hide from us. But overall, how are you feeling? I know this just happened, so you might be in a little bit of shock. Good, okay, so overall, feeling okay? Good, okay, that's good to hear. Just to quickly check, I know they probably did this in the field, but just to double check, do you know your name? Okay, and do you know where you are? Aspen Snowmass, exactly. And do you know what year it is? Perfect. And who the president is? Perfect. Okay, great. That's a great sign. So I definitely want to do a pretty thorough exam for any kind of head injury that we might be seeing. I know I heard that you did kind of a rolling tumble down the hill. Was that your first time on that slope? Graduating from the bunny slope. It's so much fun out there, but if you're not ready for it, it can be a lot. So I'm just going to start by doing a quick visual exam of you, just to look for bleeding, broken bones, anything along those lines, okay? Okay, so just checking the body for any external bleeding in the arms. Okay. I'm not seeing anything that looks obviously broken. I'm not seeing blood anywhere. Check your legs. Okay. Visually, things look good, except for a few bruises, which is to be expected. Are you feeling any pain anywhere? It looks like you're holding your wrist a little bit. Just in the wrist? Okay, let me see that. Can you bend your fingers for me? Okay, and can you move your wrist back and forth, side to side, and then a little bit of, okay, it hurts when you do that. Okay. Well, it doesn't seem to be broken, which is a great thing. I think we're probably looking at a minor sprain, so I will make sure to get that wrapped up for you. And I would just suggest I'll write you just a prescription for an aspirin regimen for a couple of days. Other than that, I would suggest icing it when you get back to your room. But I will wrap that up for you just to kind of keep it a little more stable and prevent some more of that pain or any further damage, okay? So we'll get that taken care of before you leave. Okay, perfect. Do you feel any pain anywhere else? Okay, great. Just a little bruised up. Yeah, okay, that's kind of what I expected. So next I'm just going to go ahead and check your vital signs, and check for any signs of internal bleeding. Once again, don't worry, I don't expect to find anything major, but this is definitely just a precaution, okay? Perfect. So I have my stopwatch right here. If you wouldn't mind just holding out your wrist for me so I can just check your pulse, okay? Okay, perfect. Thank you. your pulse looks good. We're hovering at about 70 beats per minute, which is perfectly normal. It seems to have come back down. I'm sure it was racing a little bit right after the accident, but things look good now. So next I'm going to go ahead and check your heart for any signs of irregular beat that might have, come from the shock of the accident or anything like that, and check your blood pressure as well. So if you'll just give me one moment, I'll go ahead and grab those tools. Perfect, okay. Okay, so if you wouldn't mind just lifting your top up for me. And take a big deep breath in for me, okay? And let it out. Okay, and one more. And let it out. And one more. Let it out. One more. You're doing great. Okay, and now just breathe normally for a moment. Everything sounds good there. So next I'm just going to take your blood pressure. Would you mind just removing your ski jacket and rolling up your sleeves for me? Perfect. I know you're all bundled up against the cold. Okay, I'll just give you a second. No rush. Perfect. Okay. So just hold your arm out, and I'm just going to go ahead and take this, wrap it around. Okay. And then I have this little thing that shows me what your blood pressure is as I squeeze this ball. Okay. So just breathe normally for me, okay? Perfect. Things are looking perfectly normal there too, okay? And you can leave your top normal for this part. I'm just going to gently press on a couple different places in your abdomen and then in the sides of your neck, just looking for any pain that we might have missed, any signs of internal damage or bleeding, okay? So I'm going to start with your abdomen and then I'll move up to your neck, okay? So I think my hands are warm, so this shouldn't be too much of a shock. Do you feel any pain when I press right here? No? Okay, that's perfect. Okay, and what about here? No? Okay, good. And then let me just press on the sides of your neck. Let me know if it's too much. Any pain in this area right here? No? Okay, great. And then towards the back of the neck. Any pain? Nothing? Okay, great. Okay, I think we're looking in fairly good shape. Okay, so I would say that overall, things are looking great, looking like we're in good shape. The next thing I want to do is just the same as I did with the body. Check your head, your scalp, and your face for any visual signs of bleeding, any abnormalities, anything that might need further investigation, as well as do a little bit of a shortened version of a cranial nerve exam that you would get at a neurologist office, just to make sure. We'll check all of the senses, and we'll check your facial muscles just to make sure that nothing was damaged during the fall. And after that, you should be good to go. Okay, perfect. So just hold still. I'll just... No pain in your jaw, anything like that. Okay, great. Your face looks normal. Your nose feels okay. Okay, and then check the top of your head. Things look good. I'm just seeing kind of a small bump right here towards this area of your head. It appears to be surface level, so I'm not too worried about it. Same as the wrist, I would definitely just suggest maybe throwing some ice on that when you get back to the room. Kind of put it on and off for a couple of hours and it should go down. I'm not too worried, but as I said, I would like to do just a short cranial nerve exam just to make sure that nothing's hiding in there. So we'll go ahead and get started on that if that's okay. Okay, perfect. Okay. So first, I'd just like to make sure that your pupils are reacting normally. This can kind of let us know if there might be a concussion or something like that. So if you would just look at the tip of my nose, I'm going to take this light, it's not too bright, and just pass it over your eyes, okay? Pupils do seem to be reacting normally, which is a great sign. If you could just keep your eye on this finger as I move them back and forth. And then look straight at my nose and tell me when you can no longer see my fingers, okay? Okay. Same thing. Okay. And okay, perfect. So next I have a couple of different smelling bottles. So what I'll do is I'll just hold each one under your nose for a second, give you a moment to take a big deep breath in, and then have you just tell me what you're smelling, okay? Perfect. And these should all be very common, well-known smells, so no tricks, I promise. Okay, so here's the first one. Just take a big deep breath in. Coffee. Okay, great. And the second. Sugar cookies. Good. Christmas trees. Not to theme my exams for this time of year or anything. And last one. Peppermint, perfect. Okay. So the next thing I'm going to do is just touch a couple of different places on your face while your eyes are closed. And if you could just tell me where you feel my fingers, okay? Perfect, okay. So close your eyes. Mm-hmm. 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 Perfect. That one was a little bit of a trick. And last one. Perfect. You're doing amazing. Next I have just a normal brush. So what I'm going to do is I'm either going to touch you with the soft side or the harder pokey side. And just tell me what you're feeling, okay? So close your eyes one more time. Great. Perfect. Perfect. Mm-hmm. 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 And perfect. Great job. So the last test that I want to quickly do with you is a little bit of a silly one. It's just to test the muscles in your face. And obviously, as we've been talking over the last little while, I have noticed it seems like things are good, but we do just want to make sure. So I'm just going to pull a few faces, and if you wouldn't mind just mirroring them back to me, that would be great. And then if that all goes well, which I'm sure it will, we will wrap up your wrist and get you out of here, okay? Perfect, okay. So we're going to start with just a soft smile and a big one and a pouty face and look surprised and angry. And can you close one eye and the other? Can you raise your eyebrows and lower them? Perfect. Okay. It looks like everything is looking good. So let me just grab my gauze and we'll go ahead and get your wrist wrapped up. Okay. So I see that you do have a little bit of a scrape on the wrist area. You probably landed on it fairly hard. So I just have a quick antibacterial wipe that we're going to go ahead and use on the area before I wrap it. And of course, you just saw me wash my hands and use hand sanitizer. So if you just hold it out for me. Does that hurt? Okay, good. Perfect. Okay. Looks like we got the little bit of dirt out of there that was in there. And next I have my gauze. So I'll just go ahead and wrap your hand up. Okay, great. And we'll just use a little bit of medical tape to hold that in place, okay? that feel secure? Okay, perfect. So, overall, I would say that you are very lucky. You don't seem to have any major injuries, no broken bones, very minimal head trauma, mostly just a mildly sprained wrist. So I would say stay off the slopes for the rest of the day. Give that lump on your head a little bit of time to go down and your wrist a bit of time to feel better. I'm going to send you home with an ice pack. All you need to do here is shake the bag, and then there's kind of an inner pouch on the inside. You can squeeze it or have someone squeeze it for you since your wrist is injured, and you'll feel it break, and then it'll get cold for you pretty quickly. So I would say just keep that on for maybe 20 minutes. Take it off for 20 minutes. Just kind of keep going back and forth like that. And just take some over-the-counter pain medication for it. Just as often as you need it, just follow the instructions on the back of the bottle. And other than that, I would say don't try that particular slope again. But you should be able to be back on the slopes maybe tomorrow afternoon, just depending on how you're feeling. Just come back and see me if anything else crops up. Obviously, go straight to the emergency room if you are feeling dizzy or confused, faint, if you have sudden bad headaches or neck pain, anything like that. Just go straight to the emergency room, call 911, do not pass go, and yeah, you should be good. And I really hope that you enjoy the rest of your vacation. Absolutely, I'm so glad that I could help. I hope you feel better. Just give me a call if you need anything else. Thank you. Okay, have a great rest of your day.